Back in the early 2000s, I was one of a small group of consultants that developed the idea of a natural cesarean section. And the reason for that was that the routine type of cesarean was a very medicalized procedure. You go into a sterile theater, your tummy is draped, and you have a big curtain put in front of you. And at some stage later, you get past a baby around that curtain, and you're very divorced from what happens in the delivery process. Whereas with a normal delivery, you push the baby out, you see the baby being delivered, the baby's put on your tummy straight away, and there's delayed cord clamping. So the idea was, how can we recreate the things that happen with a normal delivery as safe as possible at a cesarean without compromising any infection risk or the sterility of the surgical field. And so we developed a technique where the cesarean is done in the same way, but as I'm delivering the baby, we can bring that curtain down and I can slowly let the womb almost push the baby out so that you can see the baby being delivered just as you would do with a vaginal delivery. I would stimulate the baby to get the baby crying whilst that process is going on so that the baby can transition from spending its development in the womb surrounded in fluid and the lungs full of fluid to the baby suddenly coming out into air and having to expel all that fluid from the lungs and get air into the lungs and get oxygen into the baby's bloodstream whilst the placenta is still working, so the baby's never starved of any oxygen at any time. Once the baby is finally delivered, we can still delay the cord clamping until the cord stops pulsating and the baby's not getting any more blood from the placenta, and only then cut the cord long. And the midwife can then take the baby and give the baby to you to do skin to skin as soon as possible. So we recreate as much of what happens with the vaginal delivery safely at the time of a cesarean, and therefore try and not make it so medicalized and give mothers and their partners a much better experience of the delivery. And I've been doing this for 20 years or so now, and I've never met anybody who's regretted having gone through that procedure and seen the babies born and being able to bond with the baby at a much earlier stage than our routine cesarean. So the natural cesarean is now my routine type of cesarean, and there are only very specific circumstances where I can't do a natural cesarean, and I would talk to individual parents about that if that was the situation.